Feel that tightness here?
Yes.
Okay, so this is not activator technique. This is my technique. So we have Jenny here today. We're here in New York City. You are a student in forensic psychology,
Yeah.
which is pretty interesting. And you also currently manage a salon.
Yeah. So,
Students always have to work at the same time.
always.
What do you want? What do you want to look at today?
My feet,
Mhm.
because I'm on them all the time. Low back and maybe a little elbow.
Okay. So Jenny doesn't like her, popping and the cracking. So we're going to do a technique, especially the neck area you had a concern about. So we're going to see what we can do with the activator technique and see how that feels. Okay. So I'm going to have you lie face down. I'm going to give you a piece of paper and let's take you through it. Okay. Put your nose here. Scoot down towards me a few inches. Perfect. I'm going to raise the table a little bit. And the first thing we do is we check your legs, okay? Take a big breath in and blow it out. Try to relax a little bit. I'm going to put these alignment shoes on. And I'm putting them on you, not on me. And we'll just see what shows up, okay? So let these roll and move around so I can have mobility with it. But your right leg's pulling really short, almost 2 centimeters. And when I bring the legs up, they even. Let me just see. Do you have any knee pain? Okay, the knees look fine. So I'm going to push into the bottom of your pelvis on the right. That seemed to help. I'm also going to pull down on the left. And that seemed to help. Squeeze your knees together and relax. I think I'm going to start with it just seems like your body's screaming for alignment, okay? So your pelvis is tilting down and pitched forward on the right. So it's like this, but rotated as well. Usually just one or the other shows up, like a right ilium or a left ilium. But I was just curious because it looked really under a lot of stress. So it seems like either side would be successful. I think I'm going to start on the left. But just out of curiosity, when I bring your legs all the way up like this, does it increase any back tension?
Oh, yeah.
Point to the spot that increases back tension.
Okay.
And this is kind of good to do sometimes because it gives me a pre and post. So she's pointing to, look how tight that is. It's like a steel band. So she's pointing to L5, L4, L5 on the left. And here, bring these legs back down. And now take this leg from the thigh and lift it high in the air. So, yep, and put it back down. Does it hurt anywhere in your back when you do that or your hips? Good. So do this side. And how's that side?
A little.
Same spot?
A little lower even. Right here.
Okay, so she's still pointing to the left. I'm getting much more symptoms on the left. She didn't point out anything on the right. And let's do that AS ilium on the left. So what I do is I find the sacrum and I put it on a setting that's appropriate for the pelvis, and which is the highest setting. And I'm going to just left of the second sacral tubercle, I come up high on the iliac crest and adjust straight down. Right here is the spine of ischium. I adjust from posterior to anterior. I come down and look at the feet again, and they are even. I bring it into position 2, they're even. Position 3 is I break the 90-degree plane, and it stayed even. Before we do anything else, remember, we're just going to check in with you. I don't think it's clear yet, but are you starting to feel less pain when I bring your legs up? No, is what
No.
she said. By not answering, she said no. But then she's thinking, I'm going to hurt his feelings. So
No.
you were just being polite. But I'd rather you say no and give me the truth, because since we do these things in one take, we don't like recut them or reshoot them. I'm just trying to do this the way it really is. And you can even get up when you're done and say, this sucks. I hate it. I want my money back. But I didn't charge you today, so I'm not giving you any money.
Right.
But there's more to do, okay? We didn't even do the lumbars yet. I haven't lost confidence. Even if she lost her confidence in me, I haven't lost confidence. So we're going to put the left hand on the lower back, which checks out. It's like a stress test for L5. Leave your hand there just for a second. I look back at the legs, and no change. I was thinking, you know what? Look, I'm just striking out left and right with you. Bring your arm up. But believe it or not, I'm not worried. There we go. I just saw something now. And I see a little bit at L4. But I just want to palpate because sometimes I can pick stuff up. Now, you feel a lot of stuff here on the lower left, but I also feel stuff on the lower right. like tight muscles.
Yeah.
And I think that's kind of compensation. So I'm going to lean into that with my elbow. So I'm pushing into these muscles here. Do you feel that tightness here?
Yes.
Okay, so this is not activator technique. This is my technique. From also being a massage therapist for 8 years before I went to chiropractic school, I like to find some of these muscles and dig them out a little bit. I do work with a lot of actors and dancers in my office and performers. A lot of times they're performing that night. So I will dig out muscles before they go on to perform on Broadway shows or the Opera House or wherever they perform. Right in there. Do you feel that horrible tightness? Okay. So now I'm going to come back. I am going to adjust L5, L4, recheck the legs. Now what are you starting to feel?
Oh yeah, that's much better.
Are you lying?
No.
Don't lie to me.
I'm not.
It's how much better? 10%? Oh, 20%?
Like 40.
All right. We're friends again.
Much better.
You almost lost your whole friendship potential with me.
I didn't lose faith though.
I didn't either. Well, a little bit. So both arms on the lower back like this. We're looking a little higher on the lumbars. The legs are staying even. Now bring both arms to the top of the table. And we're just hopping ahead a little bit. And bring both arms down. And turn your face to the left. And now turn it to the right. So when she turns to the right, the legs go really short. So let's hop up ahead, back to center. Face back to center. And do you feel this right here?
Mm-hmm.
So I'm right up at T6. And I'm going to just adjust T6. Turn your face back to the right. Legs stayed even. Lift your right shoulder off the table high in the air and put that back down. Squeeze the right elbow into the side of the body. Let that relax. Squeeze the left elbow into the side of the body. Let that relax. Shrug your shoulders. Relax. Head back to center. Look up straight ahead with your face and back down. Tuck your chin towards your chest. Relax. Push your face down into the table. And relax. So we just checked occiput, lower cervicals. We checked scapula, rotation. So when you squeeze your elbow into the side of the body, you're flaring or contracting your scapula, and we're looking for a medial lateral scapula, which we did not see. Turn your face to the left. Any tension going that way? In the neck or shoulder blades? Neck. Okay, back to center. I'm going to do a couple of spots that I'm aware of that you have. And I'm coming here and here and here. Now go to the left first. Where else do you feel it?
I think that feels better.
She says it feels better. And this is a tough person. Yeah. This is a tough critic. She's never going to sugarcoat it for me. Here, turn your face to the right. With all the money that I pay her, she still won't give me any credit. There we go. Now back to center and turn right again. And when you turn right, do you notice anything left? Good, right?
Yeah.
All right.
Sounds good.
You're not going to fire me today?
No.
I'm pretty lucky. All right. So let's have you turn over, okay?
Okay.
I'm going to look at the feet next. So I looked at your lower back. I looked at your neck. I didn't pop your neck, right? Go like this. Now I'm doing you a favor.
Oh, thank
by
you.
checking your eyeliner. Can't say I didn't do you a favor today. Pick your head up so this will be a little more comfortable. And let's go down to your feet. Which foot was it, the right or left?
The right.
And you said it hurts in your arch, right?
Yeah. A little higher.
Higher up here
Almost
towards...
the other way. Lower then.
Lower?
Yeah, like in there.
Okay. Higher, lower. Right in there?
More to the center. Yeah.
Right in there?
Mm-hmm.
Towards the arch?
Yeah.
All right. So she's got some really tough muscle knot here. And does that kill? Or does it feel good in a way?
Feels good.
She's just trying to get a free foot massage from me. She doesn't even have an issue here. She's just like, maybe I can get this guy. Did you bet anybody? Like, I bet I can get this guy to rub my feet today. You would have won the bet. Because she has absolutely no issues here. She just wants me to rub her feet. No, but it feels good there, right?
Yeah.
Okay, so no, seriously, I feel a little bit here on the longitudinal arch.
Yeah.
And there is a bone under there that if we do a lot of walking, it's not that it falls because that makes it sound like it fell down, but it starts to tug that way. And so I'm going to kind of lift up. I'm going to go from inferior to superior and just kind of open this up a little bit. I want to check the toe. And again, I'm using the instrument. But, you know, I would have questions for her, like what type of shoes does she wear at work? Does she at least choose, especially when she's at the salon, to, you know, wear the best comfortable shoes she could wear when she's at, you know, sneakers even. Are you allowed to wear sneakers?
Yeah, that's all.
Yeah.
Stand too much and walk too much to not.
Yeah, so I am popping a little. Look, I lied.
Well, that feels good.
Good. Those are okay. I'm going to have you come stand up, see how you feel, okay? So roll to your side gently like they do in, well, that was fast.
Well, I feel better.
Do you?
I do.
All right, move your neck around. See how your neck feels a little looser?
Yeah, much
Good.
better.
And what's your foot feel like?
It's a little sore. Those
All right.
areas were very sore,
Yeah.
but I think it's gonna be better.
All right, cool.
Appreciate it.
And your lower back?
Yeah, so nice. I
All
needed
right.
this. It's been too long.
All right, thanks so much.
Thank you.